One of the keys to success of the Shawnee County project, I think, is the leadership team that actually oversaw the project.
Throughout this project, we've really had a good community partnership through different organizations such as the Shawnee County Health Agency, the Kansas Department of Health and Environment, and our local coalition called Heartland Healthy Neighborhoods.
We started this group called Heartland Healthy Neighborhoods with 5 people sitting around a table. Community Resources Council, YMCA, YWCA, Topeka Rescue Mission, and K-State Extension. And what had happened was that a number of us were very frustrated on going to meetings, and plans were being made for either policies or projects, and nothing was done the next time you went. We really didn't care who got the credit as long as it got done. And the second thing is that we would focus both on programs and policies, knowing that programs got more people involved in it, but policies made the real change. Through this, we went through a number of strategic plans, and we've grown to a group of about 100 people. We were requested by the state of Kansas, that came through the health department, if we would be interested in joining them to bid on a sodium grant, knowing that the chances of Shawnee County getting it would be very, very limited. But we really wanted to look at it, and so we offered support letters, that we would work with the contractors in it, that our leadership group would work be the intermediate, the resource that would connect the community to the grant with the health department and with the state. And we were awarded the grant. We were awarded 1 of 5, 2 being in the New York City area, 2 in Los Angeles, and 1 in Shawnee County. So we were thrilled, and we've worked the last 3 years on this grant.
And what we did was met on a regular basis. We looked at the capacity that each organization had, the resources we had to apply to this, the connections we had with members of the community.
Having so many players at the table was beneficial because everybody had contacts in a different way and were able to help move the project along.
What we've done is brought neighborhood associations into it. The why, we've looked outside, especially like with our sodium grant, we brought in the zoo, we brought in the Shawnee County Jail.
Oddly enough, the first place they looked to was the jail, and that's somewhere you don't look to first to see about healthier lifestyles. But we wanted to step up our game and help the community because we, like I said before, it's an integral part of the community, and the partnerships that we have are tremendous. And it's just those relationships that we have, and I believe everything's about relationships. Continuing those positive relationships we have has only made our agency better.
What we wanted to do was to always think outside the box. How can we get other people involved that might not be involved?
My biggest advice to everybody is to, at first thing, don't just, first of all, when you're thinking about change, that it's a bad thing. Look at how it can benefit those around you, your community, those you're providing a service to. Then secondly, I would look at the evidence base to show and to demonstrate how you can do cost savings, like reduced sick leave in staff, reduced medical visits by the inmates. And the other thing that I would say is just providing staff input and getting them to be a part and empower your staff to be part of that program. And when they're part of it, they buy off on it. They feel like a great deal of worth that they created something for the community and the inmates, and they're part of the community as well, that we all can be better citizens and healthier citizens. And I think that would be my best advice to everybody.
One of the things that was really striking, I think, was the buzz that the project created. When you're standing in line at the grocery store and you hear people discussing the sodium content of foods.
And in fact, when we got the grant, the first time I went to the grocery store, it took me 2.5 hours because every time I went to buy something, I turned it around and looked at it and went, wow, I thought I was eating healthy, and look at the amount of salt I'm getting in this.
Or when you're at an event and you hear people talking about how they've made changes in a recipe or to reduce sodium, or you're at work and people are saying, hey, did you see that in the vending machine? They've added some really new and interesting products that really taste good. So it was really gratifying to see those visible changes in the project, as well as our ability to quantify some of the impact that we were seeing in the actual reductions in sodium content of food offerings in cafeterias in concessions, in vending machines throughout the project. So I think there was a lot of real change that occurred in Shawnee County as a result of the combined efforts of the organizations that were behind the Sodium Reduction Community Project.
We feel very strongly that, yes, programs are fun and great and everything like that, but policy certainly makes a change in the community.